Learned about CPR are about to change. The American Heart Association is trying to make the business of saving lives easier and more effective in emergency situations. Joining us now is Philip Freed. He is the Chief of Cardiovascular and Thoracic Surgical Services at Lenox Hill Hospital. He is also a CPR instructor for the AHA. Thank you for being with us.
Thank you, Lester. The
first thing that I notice is that the rules have changed as to how to determine if somebody needs CPR. The old thing was to go up and check your pulse?
Exactly. We check it here, we check it here. What we realize is that, think of your common neighbor doing CPR for the first time. It's a very panicky situation. A pulse check 35% of the time is not being accurately obtained by the rescuer.
I can't find mine half the time.
And I have the same problem too. So what we've said is look for the obvious. See if your patient's moving. See if they're breathing. See if they're coughing.
Put your hand on the chest.
Put your hand on the chest. Do the old look, listen, and feel. If the patient has some sort of life signs, you know that they have to have some form of a heartbeat.
Okay,
so we're getting rid of the looking for a pulse because it could waste time for necessary compressions to save someone's life.
Now, people who have taken CPR, they know about the mouth-to-mouth, but there's a whole formula of when you push and how often. Now, tell me what has changed there.
American Heart's taken the boldest maneuver ever. They've now taken these protocols and those ratio numbers and made them international, where it's going to be standardized numbers. Where it used to be if two people were doing CPR an adult, two rescuers are doing CPR versus one person, and there was different ratio numbers. Now we've said let's keep the same numbers and try to keep focused on keeping the patient more perfused by doing compressions. So instead of using the old compression numbers, we're standardizing them to a simple number to remember, which is 2 breaths to 15 compressions, whether there's 1 or 2 rescuers involved.
So, Philip, I was at a big international airport recently. I noticed they have these defibrillators. You brought one with you. It's almost like the old fireboxes now. You see them every couple hundred feet. That's something that you and I could use?
You must have been O'Hare Airport. They took the boldest initiative ever with American Heart Association. Not even 1 minute apart from each little of those boxes that looks like a pull-down box is one of these machines. And this is simply what the machine looks like. And inside there, they even have a little mask so you can do mouth-to-mouth.
Could I use that with no training?
Lester, hold the machine.
All right.
It's simple. Push the button that says on. The machine talks to you.
Pads to patient's bare chest.
This pad?
These are what the pads look like.
Pads connected.
Okay. And as you see, the pads show you where to put them on the human body.
It says plug them in.
So go ahead and plug it in for me.
Plug it in. Okay, right in there. Okay. And we're moving fast now. Someone's in trouble here.
Now, don't touch the patient. It tells you that because it needs to look at what rhythm the patient's in. Okay. It will tell you if a shock's advised. If there's a shock advised, you can pretty much figure out in 1 second what to do.
Shock advised.
Okay, so now I know this person's heart is stopped.
This person's heart is stopped, and they need an electrical shock to get them back.
Shock now.
And I push that button?
Before you push it, make sure nobody's around, and say clear out loud.
Clear.
Just like on TV.
Shock delivered.
Shock delivered.
The machine will now look and see if the patient has a heart rhythm. Don't touch the patient because if the machine is wiggled, it could interfere with what the machine's looking for.
So these are basically meant for anybody who is nearby.
They're in sports arenas, airports, airliners are carrying them. We're getting businesses, probably even this building has.
Are we saving more lives with them? Are we seeing the numbers?
American Heart is now getting people to save lives more effectively in conjunction with this new CPR rules and having these machines. Instead of waiting for an ambulance to arrive with this, now the public has access to this, allowing the paramedics to use the next round of protocols that are giving clot-busting drugs and drugs to fix heart attacks starting in the field, in the ambulance, while the public defibrillates the patient.
Quickly, I had, just this past weekend, I had an occasion where I had to use the Heimlich maneuver, but you're also suggesting another method involving the chest for choking victims who are unconscious.
Exactly. Again, after all this literature and research over the years with American Heart, they're finding that chest compressions here with abdominal compressions combined can actually help to dislodge food that is stuck in someone's esophagus. We're not getting rid of the Heimlich maneuver. We're just giving you an adjunct now to use.
Philip Freed, important information, especially for people who took CPR. Things have changed. We appreciate you coming in here and explaining this.
Thank you. I appreciate it,
Lester. I can't believe even I could do the
defibrillation.
You
did excellent.
Thank you. I'll be back after a break. Hope you can stay with us.
A decisive moment affecting the next 4 years of your life.